Hi, good morning, everybody. Thank you so much for joining. We're just going to give people a minute to join us here, and we'll get started. You can have the text bar there that you can make any notes, and fantastic, Alice, who coordinated this, can address any technical problems you're having as we go. So let's just let people join us, and then we'll get started. Okay, so why don't we get started? So we're talking today, and I'm here from the wonderful program St. Anne's Place. What we wanted to do is create an opportunity to talk to staff about the changes going on in the healthcare system right now. And so there's some slides around what's going on, but I really want to invite people to ask questions, and this is really an opportunity to talk back and forth around questions or concerns, things you're seeing in your work. I want to start. Okay, Alice, I cannot move to the next slide. Okay, great. So my first is always to start by saying thank you so much for what you do every day. Truly, I'm facing these, and we are facing these changes in the healthcare system with such optimism because of the reputation you have created for our organization out there. You do incredible work every single day. And not only do our clients get to benefit and see that work, and you're saving lives and changing lives, but the system as a whole has really recognized our work. And because of that, and because of your work, I've had the opportunity to meet with some really influential people at this time in the provincial government. And truly, I want to thank you for that, because the only reason for that is because of the work that you are doing and people are noticing. So next slide, Alice. I think you're the one that controls this, Alice. I'm not able to do that. So as I mentioned, please type your questions in the text bar, and Alice will keep track of them, and I will have an opportunity to answer them at the end of the presentation. So this is just a bit of a recap. This is actually from last fiscal year, which ended March 31st, 2018. But this gives you a chance to highlight a bit across LOFT. In terms of the Ontario healthcare system, our bigger picture. So as you can see, we have many individuals that we serve, and that we serve them in the community. Really clearly, you see that 296,000 supportive visits in the community. I think that's really key, because it shows that people don't come to us for care. We serve them in their homes, or we go to them. And that is a very, very valuable thing that we have the systems in place, the accreditation in place to do this important work, because that is really where this Ontario healthcare system, as I'm going to talk about, is wanting to see. Another part of the picture is that we provide that complex services. So I often say LOFT's goal is not to serve 50,000 people. It's to serve fewer people with excellent care who have complex needs, who face barriers to get community health care. And as I'm going to talk about as we move forward, that is an incredibly useful focus for LOFT, because we have a very distinct role in the community sector and the community service. The other thing I wanted to highlight is that we have now over 1,500 supportive housing units. And of course, we know that people in supportive housing with that affordability and supports, don't go to hospital as much as people who don't. And so this role of providing that supportive housing is really, really key. So the community outreach van, the visits in the community, the supportive housing, those are all real building blocks that this Ontario healthcare change, as we're facing this provincial government, see those as incredibly valuable. They understand the role that plays in the community. So I just wanted to go over some information about the healthcare announcement. So initially, when Premier Doug Ford and the PC government became the leaders for the province, they ran on a platform of ending hallway medicine. So I think that's a really important message, and we're hearing it really loud and clear in all the consultations that are going forward. We were lucky to be able to host and meet Minister Christine Elliott, the health minister, and we hosted a wonderful gathering at our Crosslinks Newmarket location that she wanted to talk to people about their solutions for hallway medicine. So this was a big focus of the announcement and their work. So what is hallway medicine? Hallway medicine is the idea that it's so crammed at the hospitals that people end up waiting for hours and hours in the emergency room. And when they're getting care, they end up actually being in care on hospital beds in the hallways. As well, I've actually been to South Lake Regional Health Center where they've emptied out a room that's meant for training staff. They've emptied it out and put mostly seniors actually in that room, just like sardines. This is not best care, and many hospitals have been pushing back saying we can't do this anymore. And so when Premier Doug Ford became the Premier, he said, we're going to end hallway medicine. So everything you're talking about is really related to that message. So the first thing he did is in February, prior to February actually, he set up an advisory committee. This was led by the former CEO of Humber River Hospital, and Dr. Ruben Devlin. And he pulled together people to help advise specifically on hallway medicine. He released a report that's available online about that, and you can read that and see that I was really pleased to see their focus on community healthcare as an important part, as well as the emphasis on preventing people to need hospitalization. So we were wondering if he would say, wow, if people are in the hallways, you ought to build bigger hospitals. But that's not the way this government's going to go. And that's great for Loft. I think it's just great for the citizens of Ontario. But it has meant that the eyes are turning to the community to see what can you do to respond to this hallway medicine crisis. The other thing was very clearly mental health and addictions was named in his report in a couple of ways. One is that people who have mental health and addiction challenges and responsive behaviors disproportionately end up in the ER, in the emergency room, and they go back over and over. One of our programs at our Sherbourne High Support site in Toronto, they had a service user who had accessed St. Michael's Hospital 300 times in 1 year. So if you just look at the math of that, one person receiving better and different care, I believe a visit to ER costs about $4,000 to $6,000. So if you just do the math, it's not just the economics, but also not great care for that person, and it means other people have to wait to get service around them. So that's an example of how Loft in the past has really made an impact on this agenda of ending hallway medicine. So on February 26th, the Ontario government released this new, it's called Omnibus, means a multifaceted legislation called the People's Healthcare Act 2019. And this was to be a legislative or legal guide to assist with the province's healthcare system change. So they look at enhancing the patient experience of care, improving the health of populations, reducing the cost, which is a very central part of any progressive conservative platform, as well as improving the work life of healthcare providers, including clinicians and staff. So this was their quadruple aim, which is a standard quadruple aim through the Institute for Healthcare Improvement, but you'll see all of those aspects addressed in the People's Healthcare Act. So I'm going to talk more about what was in that legislation. The legislation presents two big changes. So the big change was the creation of one central agency. Sometimes they refer to it in the media as a super agency. We found out that the name of this super agency is going to be called Ontario Health, is called Ontario Health. It has since been incorporated. And so what that meant, and I'm going to talk more about the different agencies, very, very large agencies that are being rolled into this Ontario Health Super Agency platform. So a progressive conservative agenda and platform includes consolidation to reduce administrative costs. And so what they're really doing is saying, hey, all of these different organizations have expensive administration and leadership. We're going to consolidate them and save money and increase accountability. So that was one of the big changes. The legislation, when you read it, allows for those agencies to come together. And also it introduced a new mechanism for funding and integrating healthcare services across providers, with the top priority being improving continuity of care. These are called Ontario Health Teams. Now, this is the area that we don't really know exactly what Ontario Health Teams are, but what we know is that the purpose of them is to allow people to get care in their community and to bring local providers together to serve the needs of that population. And an Ontario Health Team will generally serve about 200,000 people. So these Ontario Health Teams have not yet a structure for those, and what those look like has not rolled out yet. But I'm talking to the minister's office last week. It's imminent. I think that's going to happen in a couple of weeks. So what they're going to do is say, hey, this is what an Ontario Health Team is, what we want it to look like, and the focus will be so that citizens of Ontario can easily get health care, and it will reduce the pressures on hospitals by allowing people who are in hospital to go back to the community and get that continuity of care into the community so they can move out, as well as avoid people coming into the hospital at all. So what we're seeing is hospitals in a new way giving and wanting to engage with community providers to figure out how we all work together as one system. That is new. The other part of Ontario Health Teams, it's potential that new funding might come flowing through those Ontario Health Teams. And we're, again, not sure quite what that will look like. So we envision, again, that as I was sharing that when the local health integration networks were first formulated, we were really wondering what would this all look like. Obviously, this lofted very well with those accountability entities, but I think so it's going to take a long time to roll this out. Even the creation of this super agency, Ontario Health, will take time. And they have introduced this larger super agency. Ontario Health has introduced their board. So they're starting to, then they'll have to look at their policies, procedures, all those things will have to be set up. So this is going to take a while. The Ontario Health Team, the establishment of those will start taking place in the spring. What I think this is all conjecture, but what I think the government will do is identify some early adopters, some Ontario Health Teams that are kind of ready to go. Those are hospitals that already work really closely with community providers well, and they're going to start work in probably 5 or 6 areas of the province. I don't think Toronto's going to be an area that they're going to focus a lot of at the beginning because there are many more providers. It's going to be a harder thing to roll out. I think we're going to see maybe one Ontario Health Team in Toronto, one in Central, but there's also opportunities in Hamilton, London, Thunder Bay that they're going to be looking at broadly in the province. So the other part is that the LHINs, who currently, it's all right, you can go to the next one, Alice. The LHINs, who are local health integration networks, who are currently, LOFT gets funded by 3, those will be dismantled. And so that notice has been given to the LHINs. Right now, the LHINs continue to operate. They continue to fund us until an alternative is arranged. But currently, there are 14 local health integration networks. They are pulling all of those into Ontario Health. And I suspect they will have some regional providers and fewer of them. So they will consolidate them and maybe make 5 or 6 regional providers for the province versus 14. The 6 provincial health agencies being rolled into the super agency are massive, massive agencies. One is Cancer Care Ontario. Cancer Care Ontario has a budget of billions of dollars, and they are being rolled into the super agency. You may have seen some op-ed pieces in the paper about concerns around doing this and the concerns about the quality of care for cancer treatment. Health Quality Ontario will be rolled in. eHealth, Trillium Gift of Life Network, which I believe handles donors and donated organs, Health Shared Services Ontario, and Health Force Ontario Marketing and Recruitment Agency. So these are ones that all were made separate agencies. They're rolling them all together. And we're expected that there's going to be 5 regional offices, and I suspect there may be one for the GTA. When you look at Census Canada, how they define GTA, it includes Hamilton, it includes Bradford, West Gwillimbury, and the North. I'm not sure quite what they're going to do because Toronto has such a high population and there's a global movement to urbanization. So over time, they'll need to figure out, and they're probably mapping out the populations for these regional offices. So we just don't know yet how they're going to do that. You can go to the next one, Alice. Thanks. So this Ontario Health Super Agency will act as a single point of accountability. They will manage performance and outcome measurement for healthcare providers. And it will also provide support for healthcare providers to better use digital tools to support continuity of care. So as many of you would be working with Connecting Ontario, you'll be working with OCANS, you'd be doing Interise, you'd be doing coordinated care plans. They're very fragmented, the different information systems that are used, and time again, this has been identified as a problem. So Digital Solutions has been very loud and clear on where this provincial government wants to invest and look at solutions. And I think many of us would agree that that would be a good idea. But that, again, is a massive transformation to undertake and will take a long time. They also have a Patient and Family Advisory Council, and that will now be made permanent and will be located within Ontario Health. So in the past, all the LHINs may have had a patient or client advisor or advisors. That's now being centralized as kind of an advisory group. And the patient ombudsman or person will now also reside in Ontario Health. So these are massive, massive organizations to be pulling together, and that will take a while. So Ontario Health Teams, as I mentioned, they'll be introduced as a new model. The idea is to be intended as a single accountable organization. So how does this relate to LOFT? So I have to say LOFT is in a fantastic position, I believe, because we have more than one LHIN. So this change to a regional office, LOFT is of a size and touches such a geographic area that we have a presence and are really seen as a strong organization that has heft and a back office that can assist with growth and can assist planning in a large area. So this does have some smaller agencies that are very specific to a neighborhood, a little concerned about what this means for their agency as we look more teams comprised of local healthcare providers responsible for delivering service to about 200 to 300,000 people. And they're not quite sure about Ontario Health Teams. There's places like Holland Bloor, CNIB, Bob Rumble Center for the Deaf, CAMH, these specialized Casey House, these specialized services that where do those belong when they serve a broader regional specialized service? That has not been made clear at all how that will roll out, but there was some mention in Minister Elliott's press conference that they may make some sort of regional office or Ontario Health Team that puts them all together. The idea is that these health teams will self-organize and will submit applications to the ministry to be accepted and seen as Ontario Health Team for approval. And it's not yet understood what that will mean. It'll likely mean that LOFT is part of several Ontario Health Teams, and we work and do our work within those Ontario health teams. And what's great is that we have the back office to support our infrastructure to engage in all of those Ontario Health Team discussions. And we are currently I've been meeting and our team's been meeting with hospitals and providers. So we're very much, I'm confident, at the right places and talking to the right people to make sure that LOFT is engaged in those conversations well. I think we still need to look at some of our great services at LOFT that are more larger geographic based. One might be our Transitional Age Youth Program, right? So it serves all of Toronto, and we have a specialized program in the Jane and Finch community. So that will evolve, and we'll look at whether some of those staff might be dedicated to certain hospitals or certain Ontario health teams as this evolves. So that's an example. I don't have the answer, but we're going to see. But I can guarantee you, I mean, I really have very great confidence, especially with Ruben Devlin's report. The intent is to support the community, and they're not sharing or seeing that there will be any cutbacks in the community. In fact, I think what we'll find is further investment. The clear reason for me why that is the case is that the community is so much more economically, it's cheaper for the government to invest in the community. And I've been very clearly saying that message. An example is our Pine Villa project last year saved $6.7 million. As a whole, our ALC work last year has saved the government over $11 million. So these are really easy, clear messages to share how we have been saving the province money, and they're very, very interested in that, and they know it. And I think so that's very clear that LOFT, I think, is in an excellent position moving forward. Next one's good, Alice. Okay, oh, it is the next one. Oh, can you go back, Alice? I'm sorry, it looked the same. Thanks. So these Ontario health teams will be required to provide those quality, continuous integrated care. I suspect there will be, say you live in the West, you know, the Newmarket, Aurora, York area, let's say that. You will then have one number you call for all of your healthcare needs, and all the agencies will be working behind the scenes to be organized around you. So the idea is, I suspect there will be one numbers to call depending on where you live, and they will coordinate the response to your care. So community care access centers or home and community care, they were rolled into the LHINs. We're not quite sure where all those care coordinators that were mostly working around seniors and home care are going to land, but they are an asset, right, for these Ontario health care teams to make access better for all people. So access has been also loud and clear that it's incredibly difficult, and we know this is true, for people who are trying to access health care, let alone mental health and addiction care or behavioral supports, to find it. And the funding will flow to these health teams as a whole rather to individual healthcare providers. So what that may mean is currently the money from the ministry flows to the LHINs and they flow it to LOFT. Ontario health teams will replace that mechanism, but we already have a similar mechanism like that with the LHINs. And as I mentioned, there'll be an emphasis on digital tools. So the ministry is currently in the process of creating a guidance document about Ontario health teams. As I mentioned, that will be released, I think, within the next couple of weeks, and everyone is very anxious to see what that means. And then the minister has indicated that the approval process to become an Ontario health team will be an iterative process. So what's interesting to me is that the province is bringing together all those agencies as part of a super agency. That is a massive amount of work. They're rolling out some Ontario health teams at the same time. So they're going to be learning how it's all going to work together. But I think this is a government that really wants people to see quick impact on the patient and person, to share those accomplishments. So they are rolling out some Ontario health teams at the same time, and they'll be carefully watching those and see how they roll out. So they'll say, well, we're going to learn from those Ontario health teams that are rolling out, and we'll see what we learn, and then we will get better and better. So a team will be established to look at the regulatory barriers to integration and providing better transitions of care, as well as how to remove barriers to innovation. So when I was meeting with Minister Elliott, she spoke about, like, what are the things that are getting in your way? This is a government that is very interested in getting rid of the red tape and making things happen very quickly. So that's an interesting opportunity, perhaps. It's also something to watch. So how is that all going to roll out? But they are looking at, they have clearly said they feel that there are too many mental health and addiction agencies. There are over 100, I believe, in Toronto. So they are looking at larger providers at LOFT to potentially play an integrator role within that sector. And as you know, we integrated with the 416 community services for women a couple of years ago. They will want likely LOFT to do that as more in the future. So that is something that we'll be watching as well. So this is a link to one of the, so you can see what the provincial government is putting out in terms of their messaging. It's actually incredibly simple. There's very little content or meat to this, which I actually thought was important to share with you, is that they have very clear message about how the patient's going to be in the future. This will be easier access, but they actually have that vision, and they don't yet have the meat necessarily on how they're going to do it. So I found that really interesting. This link is often on their email signatures, or they're sharing it as part of their press releases, but it really is very, very basic. There isn't much meat on how it's going to roll out. But I wanted to note that Staney Brown is the head of the Dalla Lama U of T Public Health School. He is on Ontario Health's board, and we've had the chance to work with him as we've been working with some of these smaller localized teams. And his focus is very much on local provision, access, and providers working together. And I think that as they see if local providers are not able to work together, or there's challenges or things not happening, they will move in and say, okay, so how can we make sure this does happen? And I suspect that will be something that rolls out in the coming years. So what does this mean for LOFT? And I would love to hear any questions you have from what I've presented. So as I shared, I think LOFT is in an excellent position for a few reasons. One is that we have a very clear message of the impact we have on hallway medicine, as I shared in the presentation. We offer a much more cost-efficient and, I believe, dignified for our people's response to healthcare, to hallway medicine. So I think that is very compelling and puts LOFT in a great position. We've also always done the complex care. So we've been saying we will be willing to be your most responsible agency to help coordinate your care. LOFT has designed its service for those who face barriers getting community health care. Those are the people that this government is most interested in, because they visit ER more and because they're in hospital longer when they don't need to be. So 80 to 90% of people who are in hospital who can't move out after 40 days have mental health, addiction, and responsive behaviors. And those are LOFT's people that we serve proudly. So I think we're in a wonderful position. The other is, I'll share a conversation I had with the minister's office a couple of weeks ago that shared that LOFT has a reputation for taking smart risks, for willing to do things differently, as very capable, great collaborators with other agencies, and not, if you will, turfy, that we work really well with others, and we have a great reputation as leaders. We also have a great reputation as getting things done, and that's what I was sharing, all of you doing that work and having those impacts. We have a fantastic reputation in that way as well. The other is that LOFT is of a size that we can manage these changes, both because we have a broad geographic scope, which just means our footprint and our impact is that much more. as well as the fact that we transcend really just one LHIN. And I think that is a very strong message, and one that gives us a higher platform with this provincial government who's wanting to consolidate. We also have a proven ability to integrate with other providers and work well with other providers, and that is a great strength as well. And the other is that we actually have concrete memorandums of understanding with every hospital in our LHINs, in our geographic area. And that is a huge accomplishment, and one that can be built upon. So we're already on the radar for all the hospitals. So I think that is also very, very key. And as I mentioned, Minister's visit, Christine Elliott's visit, could have happened anywhere. LOFT was asked to host that at their site, and I just think that that is a very, very clear message that we are on the right path. We also had I've been meeting with the associate deputy minister, some senior officials at the ministry's office, as well as Minister Caroline Mulrooney went and toured our Bradford House property. So we're just getting great. It's two things. One, we're getting great exposure, that they know who we are and what we do. The other is that they're knowing about us and asking. So these are really, really good things. So I want to share that LOFT is in the right places. I have full confidence that we will manage this change very well, because LOFT's whole ethos is that we evolve and change. We fill gaps. We've always been catered to and focused on those that face barriers around community health. And this government is wanting to address those barriers. So LOFT is being turned to for its expertise, truly, like I believe, like not before. I think this is an opportunity. The other is as LOFT's functioning as an organization is seen as lean and well run. And I think that's important as well for this government, who's looking at agencies that are not lean, are not run well, who maybe have higher administrative costs. Those are being identified as agencies that need to be looked at. And again, LOFT is in a wonderful, terrific position around that as well. So Alice has invited, if you have any questions, a lot of this is to be continued, and perhaps it might be a good idea as we learn more that I do a regular webinar every couple of months to let people know what's happening. I am working with our provincial associations around this. Our board is absolutely monitoring this as well and having lots of conversations. They've invited CEOs of hospitals. We've had a look at the legislation. So we've also had LHIN representatives all come to the board to make sure that they're also on top of this. So I'm feeling really confident, and I want to invite any questions you have. You can type them in to the text box, and Alice is going to help me monitor those questions, and I can answer them the best I can. Is LOFT, I can see this. Is LOFT actively looking for integration opportunities? That's a really good question, Crosslinks Newmarket. Typically, I'll be honest, I think that LOFT has always been open to it. And my approach to integration has been, you could go out and knock on doors and say, would you like to integrate with us? What do you think about integrating with us? And I believe we have done that a couple of times for those agencies that we would feel very, very aligned already with our work. And really, unless that agency is ready and that board is ready, I just have found that agencies aren't ready to move faster than they want to. So what we focused on instead is I've done some presentations on integration, our approach to integration, and I've had agencies then come and talk to us about it. But I have to say it has been at their pace. Smaller agencies are quite concerned about what integration will mean for their staff, for their service users, for their identity, for their brand. These are all really big questions that no one should enter lightly. So LOFT's position has just been to focus on being excellent collaborators, excellent service providers, and to have our back office in a place that we could integrate well with others. And so there are some conversations that are being had, and those are careful. I would say the smaller agencies have been slower to jump on, especially as they see Ontario Health Teams. They want to see, how is this all going to roll out before I make a decision that is a huge decision for my staff and for my clients. So we are looking, but my actively looking has more been to make ourselves actively seen as being willing to talk and as being the type of agency that people will want to work with. So I hope that kind of answers your question. But so I would say we are all always actively looking and having those conversations, but I would say many agencies are just working at their own pace and wanting to see how this all rolls out before jumping in around an integration. Any other questions? That was a good one. Harry's typing something. What does this mean for programs by law funded through hospital? So I think, Harry, what you're asking is, currently we don't have any projects funded through hospital except for a research project that's funded through CAMH for our YouthCan sites, for our youth work. And that's kind of, because it's a research project, is separate and different, I would say. So there has been some thought, are these Ontario Health Teams going to be based or anchored in the hospital? So that is absolutely a conversation that's out there. So my thoughts around that are, I do not see, and the provincial government is not saying that hospitals should be doing community work. The second is that they know that the hospital doesn't have the ability to efficiently oversee and to manage community projects. And they won't want to do anything, the provincial government, that will cost them more than it already does. So I think so funding-wise, they're going to have some serious thoughts of doing anything other than maybe what the local health integration networks did, because it can cost more. The other part of that is, and some concerns have been raised, hey, if you anchor a project program or health design in the hospital, it will be hospital-centric and not necessarily you're looking at people accessing the hospital versus investing in people upstream, right, preventing them to get to hospital. So there's been those questions. I think that I don't have an answer yet around what the impact would be, but I just want to highlight those two observations. And I think the fact that hospital infrastructure is quite expensive. They have a high percentage of administrative costs. They do provide very complex work. So I think that will cause the provincial government some question on how they fund through the hospital. But the other question around, will they anchor project healthcare design through the hospital? That's yet to be seen. And I think that calls on our need to really be working alongside our hospital partners to see how LOFT can assist with that connection and link with the community, and making sure that community health needs are addressed, especially those around in terms of equity, in terms of the people we serve who face those additional barriers to care and may not go to the hospital at all for care. One of those specifically might be in Indigenous peoples. They don't represent the same levels of visit to hospital system as you might think, given their disproportionate representation in other areas but they face those barriers. So we have to watch that. That's an area of concern, and one we need to make sure we're staying on top of. I hope that answered your question, Harry. Is there anything else? Okay. What's my next slide, Alice? Oh. It's a thank you slide. So I just wanted to always thank our amazing staff, and your participation in this, again, shows your great commitment to understanding what's happening and the provincial level. What's the impact on me, of course, as a staff in the agency I'm part of, but also what's the impact on the people we serve. So I just always want to let you hear, I want you to hear and know how essential, how important you are, and what incredible work you are doing and the impact you are having, and that this government, truly the work you do, the people we serve and how we serve them, has really transcends any political party or change, because LOFT is right in the space and serving those folks who fall through the cracks. And those are the people that often end up in the emergency room. Those are people like the gentleman here who now lives at St. Anne's Place, that lived in was in hospital for 11 years. We are serving those people, and that is exactly what the focus is for this provincial government. So I just want to thank you for always taking that leap of faith together and serving the people in such a dignified way that we want to serve, and that's our core mission. And that is quite aligned with the work that's happening right now. But I just want to thank you again for all you do every day. So thanks so much. I think those are all the questions. You can always reach me or email Alice if you have more questions. I'm happy to chat with you anytime. And we'll make sure that we connect when there's new announcements that come out, so we can have more discussions like this so you feel informed. So thank you so much, and have an amazing day. And again, thanks for all you do.